Dr. Daya, thank you so much for joining us here on Health Connection. Our topic, congestive heart failure, more common and more serious than you think. Let's get a definition out of the way. What is congestive heart failure and what causes it?
Sure. It's great to be here. And congestive heart failure is a serious heart condition wherein the heart is not able to maintain enough blood flow across the body to serve the nutrients and the oxygen that the body needs. And it results in fluid buildup in the body and specifically in the lungs. Sometimes can build up fluid in the abdomen, the legs, or the arms.
What causes it?
There is many reasons why a patient would develop congestive heart failure. And among the more serious one is heart attack, blockages of blood supply to the heart, patients who have high blood pressure for a prolonged period of time who develop a weak heart, some patients who have diabetes, and patients who have valve problems all can lead to congestive heart failure over time.
What are some of the common misperceptions and misconceptions that Americans might have about congestive heart failure?
Sure. I think it is to do with the overlap of symptoms of congestive heart failure. It can be similar to other reasons why one would get a shortness of breath. And sometimes it is difficult to tease out even when the patient comes to the physicians. We have to do multiple tests. And the misconception is to do with it's to do with multiple conditions in the body lead to the same symptoms that would be presented in a patient who has congestive heart failure.
Are some people more at risk for developing congestive heart failure?
Sure, absolutely. Patients who have coronary artery disease or blockages in the blood supply of the heart, and like I mentioned, patients who have high blood pressure, diabetes, and advancing age are probably the common reasons for congestive heart failure to develop over time.
What are some of the signs and symptoms and little signposts that we might observe ourselves that would lead us to think we might need to worry about congestive heart failure?
Sure. The spectrum is fairly broad, and patients can develop very simple symptoms such as fatigue with activity that is unusual for the patient. They just don't feel right. Sometimes the patient may wake up in the middle of the night just feeling out of breath. And in its worst form, patient will notice swelling in the body, in the body tissues. And they'll notice significant swelling in the feet, sometimes in the abdomen, and if it is in the worst cases, can notice swelling in your arms and also the face.
You mentioned teasing it out. Let's amplify that a little bit. How do you determine if a patient has congestive heart failure? How do you diagnose it?
Sure. It is based on first speaking to the patient, getting what is called as a history, finding out what the precise symptoms the patient has, and then go through a physical examination in a doctor's office and run a few more tests to find out what type and what is it that could have led the patient to have congestive heart failure. So it is a battery of physical examination combined with tests we put together to be able to come to the conclusion.
Having reached a conclusion, having in hand a diagnosis of congestive heart failure, how do you treat it and how effective is the treatment?
Sure. Probably I could best categorize it as divided into two parts. First is to make the patient feel better. And that is where what we commonly know as water pills comes into play.
Diuretics.
Diuretics. And there are multiple types of diuretics. And once we get the patient started on diuretics, they start to notice improvement fairly quickly. And the second part of it is to identify the reason why they have congestive heart failure. And depending on the condition that might have led to it, we try to take action, such as if the patient has blockages in the blood supply to the heart, you either get the patient to have a stent to get it opened up, if they need a surgery, to get them to go that direction. Some patients who have uncontrolled high blood pressure, we take care of controlling it. And patients who have diabetes get it under better control. And identifying the condition that caused it would prevent it from getting worse, or actually preventing it from coming on in the future in its worse shape than it initially was.
You mentioned a little bit ago weak heart. If you find the source of the problem, can the heart be re-strengthened? Can you reverse the effects on the heart?
Sure. Probably the best way to answer that is yes and no. If the patient has had a permanent heart damage, that'll be a little bit more difficult to reverse. But if it is weak and wherein we, based on evaluation, we think that there is enough capacity within the heart to be able to regenerate or come back, then over time the heart can get stronger. And sometimes we take measures to prevent it from getting weaker. And wherein if the heart is weak, we can stabilize it with medications. And off late, we're having good treatments to be able to do that.
We spent our own time here before we got started wrestling with technology, but technology advances. The FDA has recently approved a medical device that helps in monitoring congestive heart failure and automatically sends information to you, the physician. Is this a valuable tool for a patient with heart failure?
Sure. It is valuable in the right setting. It is typically most beneficial in patients who have the severe forms of congestive heart failure. Patients who have mild forms, I'm not so certain that it is going to be so beneficial. Patients who have severe forms, what we can do is remotely monitor the patient. Mainly what it is looking for is pressure within the heart and the lungs. And by remotely checking for these pressure buildups, if it increases, we can preemptively give the patients, call the patients and ask them to take some extra medications to help decrease the pressure and help the patient. And I anticipate with advancing technology that this will be more widely used, and we probably will develop simpler tools to be able to help patients.
Centers for Disease Control just released a report that showed a surprising increase in congestive heart failure deaths after some years of decline, a steady decline.
Sure.
What's causing the increase?
Sure. I think it's a combination of factors. The one is aging population. We have more patients who are able to live for longer periods of time. The life expectancy in the country is increasing. As you age, you have more conditions such as high blood pressure. Incidence of high blood pressure increases as you age. Diabetes risk is a little bit higher, and there are certain changes in the heart that increase your risk of developing congestive heart failure. And I think it is to do with the demographic predominantly, and also inability to control certain heart conditions that probably is causing the increase in congestive heart failure.
The answer to this next question may seem obvious, but let's talk about it anyway. If you detect and treat congestive heart failure early, do you expect a better outcome?
Sure, I think so, yes. And the earlier we detect it, we're able to control conditions that could have led to it and at least maintain the patient in status quo. And that way, we probably will influence their long-term outcome. And of late, we are actually identifying patients who are at a higher risk of developing congestive heart failure in the future. And if we find and identify that, we can get them on medications in order to be able to prevent it.
So, what does the future hold for someone who's been diagnosed with congestive heart failure?
That is slightly more complex in its question, because it is to do with the degree at which the patient comes to the doctor with. If the patient has very advanced symptoms, then it would be a little bit more difficult to get it under control. If they have milder versions of that, I've taken care of patients where we keep that under control, and patient will have a fairly reasonable quality of life.
Well, let's don't have this problem in the first place. What steps can we take to avoid congestive heart failure, and when should we talk to our physician about concerns that we may have?
Sure. I think that's an excellent question. Just like how we've addressed patients who have heart attacks, high blood pressure, and all diabetes, it is significantly to do with lifestyle modification. Patients who smoke to stop smoking. If you have high blood pressure, get it under strict control. Patients who have diabetes, get hold of it and speak to your physician to keep it under good control. And if patients develop symptoms such as shortness of breath, chest pain, or if they have any swelling in the feet, not to ignore it and put it off, to seek medical attention sooner in order to be able to prevent it from getting worse.
Doctor, very well, learned a lot. Thank you very much for your time.
Sure, it's been a pleasure.